My name is Brian Bedard. I'm a Canadian veterinary epidemiologist, but I've been living and working overseas for more than 30 years in Africa, Southeast Asia, China, and then more recently I was at the World Bank where I was the advisor on animal health and including One Health. More recently, I've moved back to Canada, where I'm working for a consultancy here, Alinea International. And we're involved in a number of areas, including a project in Ethiopia that I wanted to share with you today. This project in Ethiopia was originally funded by the larger project by the World Bank and others, the Agricultural Growth Program in phase 2, and Canada supported a capacity development support facility within that larger project. And that's the project I wanted to talk to you about. Within that CDSF, we had additional funding available, and given COVID-19 and using COVID-19 as the rationale, given that it is a zoonotic disease, to look at the broader spectrum of endemic zoonotic diseases in Ethiopia. Now, my screen is not shifting here. Excuse me. Is there a reason for that? Oh, there we are. Okay, we're moving now. Excuse me. So the program was funded by Canada in its support for through the Ministry of Agriculture in Ethiopia. Alinea International, just by way of background, is probably Canada's largest international development consultancy. We have offices in Ottawa, Calgary, in Australia, Melbourne, Australia, in Brussels, the UK, and we're in about 40 countries around the world, working on different aspects of international development, including this work in Ethiopia. I just should say that as part of Canada's international development program, women in development is very, very important. And what's called FIAPRA, the Feminine International Assistance Policy, is fundamentally mainstream through all programming, international development programming that Canada does throughout the world, and including this project in Ethiopia. And this fits very well with, if I understand or recall correctly, there was a presentation through HEAL sometime in February, I believe, on the Feminist One Health. Well, that fits very much with the agenda that we have through the program we're doing here in Ethiopia and elsewhere, quite frankly, looking at the role of women in One Health and the critical role that they play in all aspects of One Health, and especially at the grassroots or community level. So that's one of the reasons why we wanted to do this program in Ethiopia, focusing on women and the women's groups that we're working with in Ethiopia through the project. So the larger project was facilitating women common interest groups, which are more or less pre-co-ops, and starting to bring women together as common interest groups, so that they self-help groups, so that they could eventually evolve into cooperatives. And as part of this program, there was a training program and support for business and how to develop and how to run small businesses, how to run a co-op. So there was a training program that the project had been developing and connecting with a number of these common interest groups. So it was decided that we would take on about 125 of these groups. The groups are 25 to 30, and you may already be familiar with some of these groups, 25 to 30 women or youth per group. So we took on about 125 of these, and we did a mix among a number of species, livestock, commodities or production units. One was poultry, one was dairy, another was cattle fattening, and then small ruminant fattening, sheep and goat fattening. So what we did is identified 125 of these groups throughout Ethiopia, and focusing on those 5 regions in Ethiopia, we designed a program that was intended to be very basic and address zoonotic diseases. And from the perspective of the communities themselves, of the women and the CIGs, what could they do on a day-to-day basis to prevent zoonotic diseases, and particularly the endemic diseases of importance to Ethiopia. What could they do? Well, obviously, with this kind of program, you want to do some kind of needs assessments, and we did that. We did a needs assessment in about 40, I believe it was 40 of the common interest groups. And some of the things we found out through this training needs assessment is that there was a below average or average knowledge of animal diseases in terms of management and prevention. Very low understanding of some of these zoonotic diseases, transmission risks, how to prevent them, what the symptoms and/or clinical signs look like. The most knowledgeable groups were the women that were involved with poultry or cattle fattening, and the least knowledgeable were the youth involved in chicken and sheep and goat fattening. Through the training needs assessments, it was, some of the things we found out were pretty critical is that obviously a lot of the material and training needed to be done with very visual support in terms of graphics and graphic depictions to convey some of the key concepts. And we wanted to keep it very simple and avoid too much technical content around diseases, so that the communities and the women themselves clearly understood what the risks were and what the opportunities were. So what we did is we did some literature review. We looked at the publications from the government of Ethiopia as what their priorities were. We had consultations with Ethiopian and international experts around what should be the priority diseases that we should look at, these endemic diseases that were of highest risk to these communities. And obviously consultations with the government veterinarians and the Ministry of Agriculture there in Ethiopia. So it was decided through this process to focus on 5 or 6 diseases that seem to be of most concern. One of them being brucellosis, anthrax, TB, rabies, obviously, which is a big concern in Ethiopia, echinococcosis or hydatidosis or hydatid disease, and then salmonella and listeria as well. So we identified those as the key priority diseases to focus on for this training program, through which we're hoping to get the most impact. So we focused on the training content and materials on those diseases, but more importantly, we focused on, what could the women actually do themselves on a day-to-day basis down on the farm. And we felt that a really good farm biosecurity program more or less covered most of the risks associated with all of these endemic diseases, as well as some other issues. But we focused very much on promoting good farm biosecurity and all of those fundamental principles. I'm not going to go through these in detail, but most of you are well aware of these and more, I'm sure. We cobbled this together with content from actually from the FAO, ILRI, but more importantly, the government of Ethiopia itself has a very good guidance document on farm biosecurity. So we use this as sort of the driver and the template for how to control all of these endemic diseases that we were focusing on. In terms of the technical content, we again searched out, obviously the OIE and the FAO and ILRI and others have very good information. So we tried to put the technical content together in a way that was simplified, but enough to cover what needed to be covered. And we looked at in the overall training, especially for the senior trainers, because we use a training of trainers approach here, the pyramid approach that all of you I'm sure are familiar with. And in that, we did cover some transboundary animal diseases as important issues. We also found out through the training needs assessment that obviously for many of these producers, the production diseases were a higher priority for them. But then we looked at the zoonotic diseases as the main focus. And within there, we looked at, what were the transmission of these diseases, what were the risk scenarios, what were the symptoms in people, what were the clinical signs in animals, treatment for both, and then what were the ways that you could prevent or control these diseases yourself with little veterinary intervention, and again, focusing on farm biosecurity. So based on that technical content, we created a bunch of training materials. And as I was saying earlier to Saba and Xiaofan, that all of these materials are open source. I'll share with Saba after the session here. I'll share access to all of these materials that are available. They're available right now in English, and some in Amhara have been translated, but they're open source. Anybody can use them. You can take them and do what you like with them to fit your own needs. Obviously, they had to be modified for other countries. I would like to just highlight that the one, if you're not familiar with the manual, the field manual on animal diseases, the syndromic manual was developed with USAID, and Corey Brown from University of Georgia helped to put that together. It's a very nice little manual that actually is available in a waterproof, printed on waterproof material. So it's a very useful field manual that we had a number of those printed and shared with the field staff for this training program. So all of these materials are available. The really important part, as you'll see here, are these flip charts that were used by the extension workers and trainers when they were working with the farmers. They're very graphic flip charts. And also we created some posters, very simple posters that were shared with the farmers when they came to the training. And as I said, all of this material is available for anybody that wants to use it. We started with a training of trainers, and that was very interesting because I was involved in doing the training from Ottawa in Canada virtually. We used Zoom and Teams to do that training. It worked extremely well. Thankfully, we only had, over the period, it was a week-long training program, and over that period, really only had one technical glitch, but we had very good resources in Addis when we were doing the training. So we trained about 20 veterinarians and 5 or 6 regional extension staff. And I should say that the project, the broader project that was being funded, had already worked with a number of excellent facilitators there on the ground, and they were able to make sure that things were, I worked very closely with them, and they did actually most of the work there on the ground to make sure that the facilities were available, that the technology was working. For the role playing, they facilitated that, and the other things that needed to be done. The training was broken down between adult learning. Most of the mornings were spent with the facilitators and senior trainers there in Ethiopia doing adult learning skills, because we felt that was really important for the veterinarians to really be able to engage with the producers. The focus being the producers here, and being able to engage with them in a way that would make them understand the material and be able to perhaps change some of their behaviors. And then I would get involved in the afternoon virtually doing the technical training, getting involved in some of the role playing. So it was a blended type learning that actually worked very well, and we were very happy with that. These senior trainers that we trained then went out to the regions and the Wareta or districts, where they subsequently trained other trainers. And the trainers they trained were government veterinarians, government extension workers. We had private veterinarians involved. One of the shortcomings of the program, which if we do it again, we'll do it very differently, was that we failed to bring in as trainers doctors and community health workers. And I think that was a significant mistake on our part, but something that we're correcting as we go forward with repetition of this program. So the training at the Wareta level or the regional level went very well. And then that obviously turned into training for the common interest groups at the field level. We tried to keep that training down to a minimum of not more than 3 hours maximum on a daily basis over 3 days. So there wasn't impacting too much already on the burden that women are already imposed upon in terms of their daily workload. The training was very well received on the feedback and follow-up surveys that we did in all of these CIGs throughout the country. And we were even able to do some training in Tigray in spite of the civil war and the fighting that was going on there. So having done the training, we did a follow-up survey, and we were very pleased with the results. I'm just showing here, so this most significantly, which actually surprised us, the reported level of improvement in knowledge of zoonotic diseases and how to control them. We were actually surprised at this and very pleased with these results. So it shows that actually the training did have some impact, at least an awareness around zoonotic diseases and how to control them. And women reported that they were much more confident in their knowledge and an ability to manage the health of their livestock. Now, obviously, what we were not able to determine, and that's what we would love to do, is to be able to say, did this training actually impact the level of disease, these zoonotic diseases in these communities? And perhaps that's something that we can follow up with. Some of the things that we learned along the way, I think I want to share those with you, is things like logistics, timing, and translation. We were a bit rushed with that, and that was problematic. So many of you that have been doing this kind of work know that you need to give yourself plenty of lead time to prepare the technical materials in a way that they're usable and then translated. And one of the things that we found is even materials that had already been translated technical materials, we had them reviewed for translation by technical specialists and found that there were problems in the translation. So we were fairly diligent in terms of making sure that the translation of the technical materials were appropriate. The other thing that we were pleased with is that with the right resources, the right people, the right facilitators, that this blended learning does actually work, which is particularly important given what we're all dealing with the pandemic and not being able to travel. The work that I do, for example, I'm managing projects in Vietnam and elsewhere, which I haven't been able to travel. So in Vietnam, we're adopting some of these same principles around blended learning, combining the face-to-face with good people on the ground, with the international experts, and finding ways to mix and match so we get a good impact in terms of our learning outcomes. The other thing that we need to have is really good facilitators on the ground, people that know adult learning, that understand what we're trying to do. They don't necessarily have to be technical specialists, but they do need to be able to facilitate that process of transferring the learning and helping people to understand what needs to be done. Again, simplified content and graphics and visuals. We had some really good people and ISD people working, instructional system design people working with us to make sure the graphics and visuals actually were impactful along the way. Again, as I mentioned, we really need to bring doctors and community health workers into this group of trainers and working with them. And I'd like to share with you, that we were so pleased with this, and we had a demand going forward that we felt that, and we had some budget that we would like to turn this into an e-learning program, which we did. Now the project, overall project, has developed a number of e-learning modules, which are available. Again, as I say, they're open source. The content is there for you to use if you're interested. They're available on the website that has been developed for the project, and I'll share that with you. But for the purposes of this discussion, if you look at number 12 and 13 down here, those were we took the training program and we turned it into a set of 5 e-learning modules. They're interactive modules based on the training content we developed for this course. The modules are available online. They're open source for anybody to take and use. They were developed using the iSpring authoring tool, but they're SCORM compliant, so they can be loaded up into any LMS that you want to use. Again, they were designed for Ethiopia, but they're generic in many ways. And as I say, they're open source, so if you wanted to take them for your own purposes, modify them, change the content, change the photograph, change the environment of what's in there, you're free to do that with attribution, of course. So, and I'll share the links to this e-learning course with Saba at the end of this webinar, and she can circulate it to those that might be interested. I'd just like to point out that in this e-learning course, you can see here that there's some tabs in each of the modules as you go forward with resources. So all of the training is backed up with resources, whether it's OIE reference or FAO references or other materials that we develop for the specific disease and the specific part of that course. So these modules, again, as I said, are open source and free for anybody to use. The other aspect of the training that we wanted to try and touch on is recognizing the importance of veterinarians, and particularly private veterinarians, in engaging with the producers and helping with the prevention and control of the endemic zoonotic diseases in these environments. I have a personal interest in mobilization of private veterinarians. Have been involved in a number of these projects around the world, and currently actually working with a group to look at a guidance on mobilization of private veterinarians. And I know HEAL has done a lot of work in this space, and the Veterinarians Without Borders have also provided some guidance in that area. So we're trying to look at some way to help promote the mobilization of our private veterinarians. So in this particular project, there was a parallel business training program through which the women groups, the CIGs, were provided training on how to manage a CIG, how to invest, what they could do, how to do put supply, and how to look at marketing channels. And as part of that program, they were given grants to help them along the way, sort of seed grants. And part of the grant option was for them to use that money to procure veterinary services from private veterinarians in a number of areas. It could be the services themselves, whether that be herd health or flock health programs, or medications and vaccines and animal feeds. We also ensured that private veterinarians were trainers within the training group, engaging with the producers, so that they began to develop that relationship and expand the relationship, and the producers became aware of these private veterinarians as resources for them to help, not only in the day-to-day operations, but also looking at how to control the zoonotic diseases. So I'm going to leave it there. And if there are any questions, please go ahead. Thank you very much.
Great. Thank you very much, Brian. I can already see some comments in the chat box. So I will open up the floor if people who've already expressed a question would like to read them out, or otherwise I can do that. Christina, maybe we start with you if you're still there.
Yes, I'm here. Thank you very much, Siobhan, and thank you very much, Brian, for the great presentation. You have already highlighted that the trainings resulted in change in knowledge, which is great. And what are your other plans, other activities besides what you just described, including seed funds and involving private practitioners in following up, giving refresher trainings and hand-holding maybe beyond the project phase? Because we know that it takes some time for knowledge to trickle in and change into behavior, and then also change into practices and impact. So that would be my question. Thanks.
Yeah. So, and that was, I must admit, that was a bit of a shortcoming, because as the funding for this particular activity in the project was funding that was added onto the project. The project ended in July, but what we had done, we shared all of this with obviously the government of Ethiopia and the extension staff, and it's one of the reasons why we wanted the veterinarians involved, the private veterinarians, is to hopefully they can carry on at least within the limited group of 125 CIGs that we were working with, and the government extension workers and the local government staff were involved at all as well. We didn't have the resources at the time to scale this up, but we did leave the people that we were working with all of the resources to take this on, if that may be the case. We're looking at right now a follow-on project, and if we can get that in play, then we'll obviously use that to scale this up and try to make it more sustainable as we go along. So that's one of the, again, the lessons learned is the need to have the time and the effort and the budget, quite frankly, to ensure that what you're doing is sustainable and scalable within a given country. I see there's another question. Are you going to read the questions, Saba, or do you want me to look at the chat?
I usually do a balance between those two. So we can go to Helen if you're still there. It's more of a comment, so I think, Helen, would you like to continue on your point about private practitioners?
Not really, but it's just an observation that as much as we work with the community health workers, we really have the component of inviting these private practitioners in our field to participate in the dialogue meetings, but it is not really coming out very strongly. But bringing them for a workshop, I think it's a good idea. However, maybe it comes with a cost. That is what I meant, but it is a very noble idea.
I would like to share, if I may, some experience that I've had quite a bit of experience with the mobilization of private veterinarians through my work when I was at the World Bank, and also working with the OIE and facilitating this process and building on the performance of veterinary services that the OIE does in their programming, and looking at how to support and promote private veterinarians as a key resource in delivering animal health services, but also supporting the government programming in terms of delivering a public good as well. And I go back to 30 some odd years ago when I was a veterinarian in Canada. About 30% of my income actually came from government programs. So the government subsidized my travel to do vaccination, blood testing, and other health certificates, movement certificates, all of that kind of thing. As a veterinarian, I made a living doing some of the government work. And we've seen this work in a number of other countries where the government services delivered by private veterinarians on a cost recovery basis is workable and also helps to promote private veterinarians. And on the other side, if farmers are aware of the services that private veterinarians can give, they will pay for that service if it is of benefit. And it really doesn't matter what the cost is. If it provides benefit to the farmers, they will pay for that if they see benefit. So the important part of it is to show the farmers what private veterinarians can do. You have to pay for it, but at the end of the day, you get what you pay for. And my experience has been that if it's done in the right way, producers, and particularly in this context as groups where they have a little bit more buying power, can engage with private veterinarians more effectively. I've seen this in projects that we worked on that's still going in Kyrgyzstan and Armenia and Azerbaijan and elsewhere. And I know that ILRI was working on, we actually engaged with the HERD project, I think it's called, in Ethiopia, where they're doing a pilot project with private veterinarians where they're giving coupons for veterinary services. So the producers get coupons that they give to the private veterinarians, I believe, and the veterinarians are then reimbursed through the program. So they're trying to see if that can work. So they're different models. My feeling is that given the constraints and limitations of government veterinarians, the government budget in many countries, the role of private veterinarians is very, very important, and we should really be looking at that more seriously. Apologies for going on about this, but you can see it's something I'm very passionate about.
No problem. I just want to make sure we can get to some other comments and questions. So Temesgen has his hand up. Would you like to unmute and ideally put your video on as well? If you're asking a question, please put your video on. Thanks.
Yeah, thank you very much, Shovan, and thank you very much, Brian. It's really interesting, especially for our program. This is Temesgen Abbaba from Hill Project, and I really impressed about this program and having an open access for materials. I'm really impressed by, actually I do have a couple of points to raise. The first would be the private sector. As you know, in most areas, especially in Ethiopia and elsewhere in Africa, most services are given through the public sector or other partners, especially the training activities. I would like to learn more about how training is sustainably be provided by the private sector, because it needs a resource from the government or from other partners. So the sustainability might be a bit difficult to continue with delivering training, especially with the so-called self-help group or similar interest group, because they might not be volunteered to pay for the training costs. So how would it be sustainable at the ground level? The other one, if I can finish, the other one, I really aware of the FIAP with Global Affairs Canada funding, because I have been also in the similar program. How would be the engagement of the male engagement in the program? Because usually when we select only female groups, usually we increase the burden on them. At the same time, they might not get a backing from the male counterpart. So how was the male engagement? Because we have been challenged. I remember we have similar group of self-help group, but the challenge comes from their partners to involve in meeting, to involve in training and etc. So how was really the engagement of male? The other point related with this group might be making them official and sustainably resourced from microfinance or any resource, any situation. So how would it be really sustainably continue as a group? Because usually in Ethiopia, for example, there is a group of RUSACO called Rural Saving and Credit Association, which might be upgraded from these types of informal groups. So how was the plan just to make it official and continue on as a group? Maybe the last one is the poultry development.
Actually, no, let's, sorry to Meskin, we need to make sure everyone gets a chance. So if you just want to focus, maybe Brian, on, I think the first two aspects, one, the sustainability, and then the involvement of men. Thank you.
Thank you. So the sustainability, and you raise a good point, and that's one of the reasons from the private sector perspective in terms of this kind of training to benefit, especially livestock producers. So what I've seen over the years, and we tried to do some of it in Ethiopia, but we really didn't have the resources to do as much as we wanted in that area. But we engaged with some of the dairy processors. We engaged with some of the feed companies to the extent possible, and obviously the private veterinarians. And I think this is where, like, this kind of training materials is good extension and actually a marketing tool for the private sector, as you've suggested. So whether it's poultry processors or dairy processors or feed companies or private veterinarians, as part of their extension and training services, that's the way to make this more sustainable than depending on the government resources to deliver this as a public good. I am not very confident in the public resources and extension services to be able to carry on with this, given their limited resources and limited budget. But to the extent that you can engage with the private sector and, you know, let for example, a dairy processor say, well, here's a great training program that we can deliver to our suppliers and the farmers that supply milk for us, or even the co-ops. You know, the common interest groups were our precursors, more or less, to cooperatives. So the co-ops were another area we engaged with, and to see if co-ops were interested in becoming part and using this training material as well. In terms of male engagement, I think the best way to answer that is that this was part of a larger project. The CDSF project had a very significant gender lens on it, very much mainstreaming gender throughout the project. And one of the resources they developed in a training program, in fact, was around a gender toolkit for these common interest groups that went beyond many more than the 125 we brought in for the livestock side. They developed a very good gender toolkit to help to promote women, engage with men, and to help to promote that gender dynamic in Ethiopia through everything that they were doing, not in the agricultural sector at least. That gender toolkit is also available open source for anybody that might want to use it and adapt it to other areas. For example, I know the World Bank has taken that gender toolkit and is using it for some of their programming in the livestock area in West Africa. So that's another resource that if you're interested in that, the gender toolkit would be available from this project as well. And if there's anybody interested in that, Saba, just let me know and I'll pass the gender toolkit on to you, okay?
Thank you. And I think that actually speaks to a comments that Esther, or a question that Esther was going to ask around, do the modules have a gender lens? I think, Esther, did you want to elaborate on that, or is that satisfactory?
Thank you. This is sufficient. Yes. So do these modules on zoonosis, do they consider specific aspects in the daily lives of the women?
Yeah, one of the things we try, well, in that aspect, we wanted to be very careful that when we did the training, we weren't imposing an additional burden on their daily work. Now, it's inevitable, you're asking them to spend an hour or two or up to 3 hours of their time to do this, and that distracts from some of their other responsibilities, that's obvious. So we tried to reduce that impact, and rather than bring them to a residential program for 3 days, we tried to break it up and go to them in a convenient location so that they only were losing maybe a couple to 3 hours of their day to take on this training. I don't know if that answers your question.
Esther, is that
well, not completely. I mean, not the way the training is delivered, but rather the content of the modules. Do these modules address specific daily issues of women, what they can do, what they could foster also to control these zoonoses? I mean, you have showed us that you essentially also promoted the good farm biosecurity guidelines that most families can easily implement. So did you specifically show role models or something in these training courses, also these available online training courses? And you also have mentioned this gender critical guide or whatever it is. I mean, is that also included, or aspects of it are included in these?
Yeah, so we didn't, that's a sort of a backup resource, the gender toolkit that I'm talking about. And all of the women that were involved in this training were involved in the training associated with the application of that gender toolkit, as well as their families. So it wasn't just about women, it was sort of looking at the whole gender dynamic in a community or within these common interest groups. So that was the background. They all had that baseline, and then we built the business training and the animal health and One Health training on that baseline of gender training that was done. The modules, the e-learning modules, and we need to be very careful, the e-learning modules are not targeted at the producers and the women. The e-learning modules are targeted at the trainers, at the veterinarians, doctors, paraveterinarians, extension workers, and community health workers. So that's where the e-learning modules are targeted. So more or less the training of trainers. We don't have specific components in the modules that focus on gender issues, although the gender issues are embedded in the modules. So I'm not sure if that answers your question, but the the e-learning modules are very much focused on what needs to be done, and obviously that what needs to be done, my impression for the most part ends up women doing what needs to be done, but also some men.
Thank you very much, Brian.
Very nice to see you online, by the way, Esther.
Yes, sorry I didn't put on my video yet. I broke my
No, that's okay. It's been a few years. It's
stuck
been a
at
few
home.
years.
Yes.
It's been a
You
few years.
imagine Kyrgyzstan, perhaps even
Yeah.
also Armenia.
Yeah. Yeah.
Can I just ask a follow-on question related to the trainers? Are they, I mean, when you start to sort of talk about veterinarians and various other groups, I imagine then the trainers are often men. Is that right? Are you selecting women as trainers specifically, or
Men
how
and
are you
women.
managing that? Yeah.
Men and women. I wanted to have 50%, at least 50% of the trainers to be women. And I think it was about a third. So it's
Okay,
both
that's
men.
better than I imagined. Yeah, yeah, because
Yeah,
we
so
we
it's
found
men
that
and
quite
women.
hard here.
Yeah.
Especially
So
when
yes.
you're engaging with technical
Yeah.
audiences, it tends to be men. And so in terms of, well, no, with a third, that's quite reasonable. I was thinking there might be issues just around gender dynamics in the training side of things.
I didn't see that in the training that I saw, but you know, who knows? I appreciate what you're saying, Stefan.
Okay, so there's also a comment or question from Mohammed, I think it is. Yes, Mohammed, would you like to unmute and put your video on if you're able to, or would you like us to just read out the comment?
Yes.
Go ahead.
This is Muhammad from Ethiopia, and I would like to ask. I would like to know that how will be the linkage between these different staffs that is from the region to Warada that were trained on a zoonotic disease. How will be their linkage in the detection and reporting of this specific zoonotic disease that we targeted in the project?
Okay, so Mohammed, the program wasn't intended to be looking at surveillance or detection of disease and the linkages per se, but the trainers at the regional level and at the Wareta level, when they did the training, part of the training was in the farm biosecurity component was around record keeping and reporting. So the issues around surveillance and reporting, and particularly communicating with the government veterinarians and with the private veterinarians on any of the disease. So we went through each of the diseases, looking at what the clinical signs were in livestock, or you know, in poultry and livestock. So, and part of the training included the need to ensure that when they had these things happen within their flocks or their herds, that it was then reported to the government veterinarian, ensuring if they didn't already know who the government veterinarian was and where they were, that they did know, and that they would be reporting that to the government veterinarian. So that's how we sort of fit the surveillance and reporting into and supported sort of the reporting and surveillance and detection of these diseases. Does that answer your question, Mohammed?
Yes. Thank you.
Yep.
And it was interesting, you said earlier how you hadn't sort of measured if this was then translating into, you know, improved. I mean, it's the two sides of the same coin, right? You increased awareness could mean increased detection, so it looks like there's more disease, but actually on the other hand, it could be prevention, you know, greater prevention, so less disease. So certainly an interesting area. So we have another question. Sorry, go ahead.
No, I was just going to say that's actually something that, you know, if I had the resources and the time, we would have looked at the you know, the incidence of these or the prevalence of these diseases in the communities or and then follow up a year later and see, you know, what the outcome is.
Absolutely, but the conundrum in public health, you know, measuring something that doesn't happen.
Exactly.
Okay, we have another question from Helen, who I think you're happy to unmute and ask. Helen, go ahead.
I'm just wondering, because I saw from his presentation that he had some cases scenarios to the participants, the women groups. So I'm just wondering if there was some maybe simulation exercise in case of outbreaks.
So yeah, there were role playing. So we did role playing, and in the technical manual and so we had two manuals. One was a technical manual about the diseases and what you needed to know to simplify that down. We had a separate manual, which is a facilitator's manual. So that's sort of adult learning, and within that there was role playing around diseases and disease reporting and what do you do if you see the disease. The other interesting thing we actually did some public service announcements on radio combined with this training. So as we did the training and we followed up, and during the training, we did public service announcements around veterinary services, around some diseases, and around what women were learning in the training. So these went on the radio throughout Ethiopia. So and through that process, we were in the public service announcements, there was some role playing, a scenario where somebody identified a disease, or there was one on rabies, I think, as well. So that's how we dealt with the scenarios, was the role playing within the training about how they dealt with some of these diseases and problems they might be having and how to deal with it.
I can see from the comments, Helen saying great. Okay, so do we have any other questions from people at this stage? I think one of the considerations that we have at the moment, Brian, in the HEAL project is whether to go down the path of developing our own training materials versus, leveraging so much that's already been produced so far, including your own materials. I'm just wondering if there was any process that you went through in your project to make that decision. Did you find that other training materials were inadequate? Did you feel that something was needed that hadn't been produced, or so forth?
So you raise an excellent point, and this is something I work in the food safety space as well, and it's the same issue there. For the One Health training, a lot of it seems to be embedded in academic institutions. So by default, the training is very academically oriented and at a fairly high level. So there's lots of material out there, a lot of it through some of the international agencies, a lot of it through different universities, and I can share the list of universities and where we accessed a lot of this material. What's missing is how to get that down to the level of where it's really needed, sort of at the grassroots level, as we say, where the rubber meets the road. There's a real gap there, and that's where I believe the community practice like yourselves has a lot to offer to develop these training materials to help to get to that level. So we looked around. A lot of this, like the stuff out of the University of Georgia, was very good, but it was very disease focused and technically focused towards veterinarians. So, and that tends to be what a lot of the One Health stuff is. It's focused technically to veterinarians and animal health specialists or doctors and community health specialists, where what we really need, I believe at least, is some of the training that is a little bit more applied and practical and not so technical. So I don't know if that answers your question, Shafan, but
no, absolutely.
Yeah, go ahead.
But you're also seeing the technical people as then the trainers who are contributing, the cascade sort of approach to things. So I think we've made a similar observation that there's fewer community-based kind of training modules and materials. But then on the other hand, you've now created this yourself, so it would make sense, I think, for us to really consider what you've done and see if they're the kinds of things that could be adapted. And the fact that you've accompanied that with a facilitation manual and so forth is quite useful.
Yeah, the other thing I should say, when we first got these veterinarians into the room, they said, well, what do we know all this stuff? Why are we doing this? Why do we need this training? And it took quite a bit of explanation at the beginning to say, like, yes, we know you're the technical experts and that's why you're in the room. But what we need now is to take this technical information and put it in a language and an approach that the producers, many of whom are illiterate, can understand and can figure out what to do on a day-to-day basis and have ownership of this. And that's where, the skills around adult learning, engaging with people, communication, That's where I believe the gap is. Yeah, there's lots of good veterinarians around. That's not the problem. The problem is, how do we get the producers and the millions and hundreds of millions of livestock producers around the world to be able to take ownership of managing this themselves?
Yeah, absolutely. Teaching people how to teach, I think, is
Yeah,
a big component of that. Okay, we're pretty much at the end of our time limit. So we've got 4 minutes if there are any other burning questions, and I'm just quickly catching up on my chat. But I don't think there's any additional comments apart from Saba suggesting that people can drop an email to Saba. She's got her email address in the chat box there. So Brian, you will share your materials and the links to the materials, and then people will be able to access them through Saba. And we'll also use our website and other means to try to promote that as well. And then we have Lara, who's thanking you for the presentation and heading off to another meeting. So I think that it's probably the same for everyone else. So thanks very much, Brian. I'm sure we'll be in touch and maybe should look at ways to continue some of this work and maybe partner up either through HEAL or broader ILRI initiatives in the region as well.
My pleasure. Thank you. Thank you for the opportunity to share this. Much appreciated. Thank you all.
Really appreciate your time. Thanks a lot.